Well, the first thing as I look back on it was how rapidly this all occurred. We had been planning for a pandemic for years and years. And when I think back of the events and we were involved in that initial case, and then how quickly from the first cases confirmed in California and then Texas, when I think we all knew something was up, and how quickly it evolved from those first cases to essentially the public health emergency declaration, and then it just took off through the country, although the pandemic declaration wouldn't come until later in the summer. I think we all knew it happened, and I think from all our planning exercises, we had assumed, or at least I had assumed, we'd have some weeks, something would happen somewhere else. We're going to have a little time to brace ourselves, make sure the staff are prepared, enough reagents and so on. And that didn't happen. It just, the event hit, and then we became involved. And then pretty much from late April, and we were able to do testing. We had the 5-target IVD assay, and then the remarkable effort of CDC to get us the 2009 H1N1 specific assay from about the 1st of May on into the middle of June. And in retrospect, it kind of went by as a flash, but that was an event I don't think most of us will forget. We went from doing single numbers of specimens a day to 300-400 in a day at our peak, and then even as we kind of tailed off on that into some low number of hundreds, and then as we got through the summer, more into June and that, even then we were leveling off into some tens of specimens throughout the summer. And having studied influenza for a large part of my career, the fact that we were still testing for and finding influenza throughout the summer was really remarkable. Once we got through the first wave, or first phase wave of the pandemic, and again, this is fairly representative of other public health labs. We anticipated if there was going to be an emergence in a pandemic, it would be appropriate for the public health laboratory to be the lead lab early on, and we assumed with the tools given us by CDC that would in fact be the case, and it was. So during that first phase, it's not surprising we were getting hundreds of specimens a day, and I was all right with that, because in the earliest part of a pandemic, you need to be, I felt, if you're going to err on one side or the other, either too little testing or too much testing, it was my opinion and that of our health department, err on the side of a little too much, because we wanted to characterize the outbreak, its clinical presentation, its epidemiological presentation, and really know what we're dealing with. We knew there would be a huge demand for testing, just because it was novel, and then once it had established and we knew we were in the first phase of the pandemic, there'd be a lot of testing being driven just by clinical need, sick people going in to the doctor. That's what presented the problem for us in other labs. It was in that transition period. Well, once we got through that first peak and things tailed off through the summer, what we were able to do is we had already identified a number of other laboratories who had molecular testing capability in the state. At least 3 of them had helped us through the outbreak. We weren't the only laboratory doing testing in Wisconsin. But we identified and were able to reach out and talk to other clinical laboratories who were anticipating bringing on diagnostic testing for 2009 H1N1. We knew there's a strong likelihood there would be at least a second wave, probably more, and that remains to be seen now as we're coming out of the peak of that second wave, what's going to occur. We talked to some other labs. We had a meeting of some of these labs on what we might anticipate, what is their intentions in bringing on diagnostic testing, how can we help them get there. They were able to start ramping up their diagnostic capabilities through the summer and as we went into early autumn, and our intent was, once we got through that first peak, we could go back to focusing on surveillance-based testing. We have a very extensive surveillance system in Wisconsin, so I can get as many specimens I need to get in from throughout the state, and we can kind of modulate the numbers that are coming into my lab to satisfy the needs of our state division of health. We're a standalone laboratory. We're part of the University of Wisconsin. We serve our health departments, both state health department and local health departments by statute. And so they have the epidemiologists. They help direct a little on what level of testing we need to provide, and we make sure we get those specimens coming in. Well, we were able to then focus on that surveillance aspect, and the clinical laboratories, when we knew the second wave was going to come, could focus on the huge surge of clinical patient care type testing that we knew was going to occur. And in fact, it did. By everybody's prediction, once school got back into session and the universities got back into session, flu activity just took off. And at least in Wisconsin, and kind of mimics what's been seen throughout the rest of the country, it probably peaked about 3, maybe 4 weeks ago, it looks like now in retrospect. So we've gotten through the peak. It's starting to come down. From my perspective now, we're focusing on making sure we get enough specimens in now for surveillance, because we're no longer doing the testing to support patient care. So now we're trying to keep a fairly steady level of testing to make sure we get the necessary surveillance data we need. Keep an eye out on what is the level of 2009 H1N1 activity. Do enough testing so we can detect the first cases of seasonal influenza, whichever one is apt to come during the normal flu season. Also do testing for the other respiratory viral pathogens that make up a large, even in the face of a pandemic, it makes up a large burden of the respiratory illness in the community. The clinical laboratories, to their credit, have really taken the burden off us and have gone through what we went through last spring, where they have had to do an incredible amount of testing. For them, it's what they do. This is fee-for-service testing, so they're getting reimbursed here. They've been extraordinarily busy, though, but we owe them a bit of a debt of gratitude because that's testing that otherwise would have been pressure on my laboratory.